Hey everyone.
Hello.
Hi.
Nice
Happy
Nice to see
spring.
you.
Hopefully we're here, right?
Yesterday felt like it in Ontario.
Oh,
I was like,
it's
oh, summer is here. I sat on my porch for a few minutes. It was lovely. I was like, hey, we're back. We're back. And then I tried to do that this morning. I was like, nope, not quite. I'm like sitting there like shivering.
No,
Like, okay, it's not warm enough up here yet.
yeah.
feels like the longest winter we've ever had. It's
Yeah.
just, it's been nonstop. I'm ready. Like
I
I
want
want
sunshine.
trees and
Yeah,
everything's
I'm
gray
willing
right
to take
now.
a few more cooler days and evenings, provided there's sunshine.
Have you been on the
Yeah.
golf course, Anne Louise?
Not here.
Not here. Oh,
Oh
here.
yeah, you were away in Florida, weren't you?
Yeah. Yeah, only because we had already paid for the house, but yeah, we laid low, but it was very interesting. It was very, very quiet. Very quiet. Golf was cheap because there's not a lot of people there.
Yeah.
Yeah.
Oh, it's pretty wild right now, but
Yeah.
it'll calm down.
Well, you know,
It'll get better.
yeah, well, we'll see. It may take a whole nother few years before that happens,
Yeah.
but we'll enjoy Canada even more.
Yes.
Yeah, I'm starting to I was mad. Ontario and I, the North and I were fighting for this winter. We were in a fight. And then now I'm not so angry. But then I was kind of going through and seeing all the damage that's been done from all the trees coming down with all the ice and stuff. And I was feeling very grateful for everything kind of melting. And then it's this big snake came at me and I
Oh,
was like, no, the snow can come back. The snow can come back.
Oh boy.
oh my God. You've had the
Yeah,
adventure since you've moved up north.
I
It's
know. It's been something. It's
nice
been
to
something.
hear.
Yeah.
Hello, everybody.
All right. Well, I'm looking forward to today.
Me too. He's
Too.
gonna brighten us up.
Yes.
Yeah.
So,
Oh, I like that. It
yeah,
took me a moment.
Really
welcome
sorry about all the
everybody.
pins. We have pins and we have puns today. Okay. So hopefully you will laugh along as we will laugh at our own jokes. So thank you. Yes.
It's always nice to see you guys.
Yes, good to see you
We're
too.
lucky we get to do this. At least we get to see each other once every month or every couple months
Yeah,
online.
I
Nothing beats in
know.
person though, but we have some things coming up in June that I'll share where we'll all be in person, which will be really nice. So welcome to the RDH View. For those of you who are new to our show or to RDHU, we just thought we would take a few moments to introduce ourselves. My name is Kathleen Bocrossi. I'm the founder and president of RDHU, which is a professional development company for dental hygienists. We just celebrated our 16th year in January. I think Anna Louise has been with me since the beginning, right, Anna Louise?
Yes. Yeah.
Um, and then
Watched you
Kerry,
grow.
Kerry, you've been with me for 10 years. Beth, almost just as long, 8 years,
Yeah, 8 or 9.
eight or
It popped up
nine.
on LinkedIn the other day. I think it was,
Aw,
yeah, LinkedIn said 8-year anniversary a couple months ago.
aw, 8 year anniversary.
I know. Aw,
Yeah.
right back at you.
Oh, there, I did it.
You did it. Mine was too wobbly. Didn't catch mine.
And maybe Beth, you'll introduce yourself next.
Sure. Yes. So I'm Beth Parks. I am the manager of clinical affairs for Curion, and I've been a dental hygienist for about 20 years. Our class is coming up on our 20-year
Wow,
anniversary.
you
So
only look 20.
love. I know everyone is sitting out there thinking like, oh, did you start when you were one? Right? I know you're all thinking that. But I'm so happy to be here. I love the profession. I love you ladies. And yeah, so thank you for joining us. I'm just really excited to learn from Kerry today.
Okay, and I am Anna Louise Tolan, and I have been practicing since the Stone Age.
No.
No, 40 years. And certainly have had the honor of watching the evolution of the profession grow so much, and so happy about that. And I'm delighted to have been a part of the inspirational RDHU that has helped so many of us, grow within our own profession. And I love working with these ladies too. So go take it away, Kerry.
Well, I'm Kerry Lepicek. I love being on the RDH View. It's been really a nice way for us to get back to the community and share some knowledge and interview a lot of different people. My day job, I work at Clinical Research Dental as their clinical specialist in dental hygiene and education. And so it really is a great opportunity that I get to kind of help educate and launch different prevention line specialties to help all that we do in the clinic. So, and yes, thank you, Kathleen, for giving us platforms and opportunities for us to kind of all come together. So I'm I'm happy to be part of this community. It really is a great community to be part of.
We're so lucky. I know. I just feel like every time I go to a conference or something, I'm always just so grateful because I don't know of any other like any of my friends or family who have what we have.
Mhm.
Like that we get to go away and be with our friends, we get to grow and learn, and it's such a special profession that we chose. So I'm always very thankful that I chose this path. So just a little bit of housekeeping before we get started. If you have, I can see already a bunch of people are already using the chat. So if you just want to say hello and let us know where you're from, that would be awesome from in the chat. If you have a question for us, we will try to get to all the questions for today's topic and just put that in the Q&A. We do have, some of you are watching this live and some are watching the recording. So for anyone who's registered, the recording will go in your portal, your RDHU portal. If you don't have an RDHU portal, you will get one after this show. So give us, we got California.
Yeah.
I think I saw
Virginia.
Saskatoon, love it. So it'll go into your portal. So we do have a short quiz that we will have you do, and then you'll get your certificate. So just give us a few days, a few business days to get this recording and get it loaded into your portal. But anyone who's watching this, you will have access to the recording and the certificate. So I'm excited to have our special guest today. We get to have Kerry Lepicek. I have shared a little bit already about Kerry, that she's been with us and my friend since, I think 2015. I'm really happy to have Kerry in my life. She is a sought after speaker, educator, and consultant in the dental industry. She's known for her passion, boundless energy, and engaging style. With over 2 decades of experience, she has dedicated her career to helping dental professionals elevate their patient care, particularly in the areas of oral malodor, biofilm management, and the oral systemic connection, and now adding whitening and lasers to your tool belt. So Kerry is a natural connector, and her true superpower is networking. So I often refer to her as the Energizer Bunny because she's always on the move, always making new connections, and somehow still goes strong at the end of the day while the rest of us are winding down after a long day at the conference and we all want to go to bed, but Kerry's off to this social event and that social event, and just has such a special way of lifting others up and sharing insights and making people feel pretty awesome along the way. So thank you, Kerry, for all that you do. So I am excited for today's program because I don't know if you're like me, I could use a refresher on whitening. There just seems to be so many different treatment options available. And, I hear from some people that they don't even offer whitening in their office. We have home kits, we have in-office treatments, we have customized home kits, and what verbiage to use. And some even refer out to like the local drugstore. So it can be overwhelming for both patients and providers. So and we want to steer them away from products that are going to cause them harm and sensitivity. So I'm really excited about today. And so I'd like to start with Kerry. Like, patients are always looking for a whiter smile. And why do you think it's important for us to have that conversation, to have chairside with our patients and to offer different treatment options for them?
So I've been in hygiene like Beth, I only was born a year ago, but been in hygiene now, practicing for almost 25 years, which is crazy to think. But I think back to my patients' needs. And we always focus on perio and gingivitis and decay. Like that is like right top and center, right? That's where we're in. And now we're biofilm blasters. But maybe whitening was an unmet need that our patients had that we didn't take the time to ask or discover or question. Because sometimes it's not sitting there like, a wall of calculus that says, oh my gosh, I need attention. But if we don't start that conversation with our patients, if we don't explore it or let them know we carry and offer these options, maybe there's something that's really upsetting them. Maybe it's bothering them more than what they know. And when I think about interactions that we have with our patients, with our community, how many of our patients sit there and smile like this and they cover their smile? Maybe they're covering it because of the positioning, the malocclusion they have. Maybe they're covering it because they don't like the color of their teeth, or they're embarrassed about a crown that doesn't match the other ones. And so did you realize there was actually a national survey that was done by the American Dental Association and Crest, and it found that a smile outranked all other attributes, including eyes, hair, and body, as the most attractive physical feature. And so to me, making sure your patients have the ultimate opportunity to have that perfect smile, I think is one of the best options. And this is where whitening can come in to help elevate their confidence. Because if you smile, smiles we know are contagious, right? Just for some reason, like hiccups and sneezes can be, but smiles are contagious in the good way. And the reason they're in the good way is they help us with endorphins. They can be natural painkillers. They help with serotonin. And these three neurotransmitters help make us feel good from our head to our toe. And there's studies and research that starts to show and say, how smiling can elevate your mood. It reduces your stress. It can actually suggest that you're even more successful if you're smiling around and everything else. And it really conveys confidence. So to me, when I think about whitening and why we should put it in our practice, there's a few reasons, but one of them is, to me, a white smile helps us provide confidence, but as a dental professional, it helps us help our patients feel more confident. And that is really where we have that opportunity. So for me, early on in my career, we were well into the whitening. We did it on a regular basis. We had it baked into our treatment plans. Where my middle section of my career happened, I don't know why we fell off the radar and it wasn't really top of mind. It wasn't incorporated into treatment plans. It wasn't, this is what we do here. These are the services we offer. We got a bit shy about it. And now in my last stage, not that I'm retiring anytime soon, but in this other quarter now I'm coming into this next decade, I really want to make sure that it is back at the front of mind as an opportunity, because there are many people that suffer from concerns with whitening or with not liking the look of their teeth. And it really does affect their self-confidence. So I actually want to share a little video with you that I found really, really impactful and very, in some ways, it was shocking, but I think we all have patients that will relate to how this individual felt. So here, I'd like you to listen.
One of the most important reasons of why I developed opalescence was because of my daughter, Jelena. She was 14 years old at the time. She wanted her teeth whiter. I couldn't understand why. I thought they looked fine to me. I even took my Vita Shade Guide home. Look, love, A3, it's even on the lighter side of the scale. Dad, I need my teeth whiter. Dad, I need my teeth whiter. She started cutting advertisements out of my dental journals. What about this, Dad? What about that? When I'd come home at night, I could almost expect on my nightstand one of those yellow Post-it notes. Back in the late 80s, they didn't have moldable colored Post-it notes. They were all yellow, so there was the yellow Post-it note. How are you coming, Dad? Where are you at? I told her, be patient, love. I'm working on something. We finally had the sticky viscous composition I wanted, a soft, thin scallop tray. I had her load the opalescence on the right side, the proxy gel on the left. I told her not to take the tray out until you wake up in the morning. And then, don't take it out. Come find Dad, and we'll take it out together. We did. In one night, she'd gone from A3 to A1. We were excited. I shot a picture. I still use that picture in my lectures. It was a few years later that Jelena told me why she so desperately wanted her teeth whiter. She said, "Dad, I was being teased in school. The kids told me I was dirty, that I didn't brush my teeth, and they knew you were a dentist, so they twisted the knife." Jelena is now known as Dr. Jessup. She's my boss when I work in the dental office. I'm a lucky guy.
Let me
Okay,
mute myself. Hold on. Yes. So
that
that,
gave me goosebumps.
I know, isn't that a really interesting story? And it wasn't until I really started diving more into this about a year and a half ago that it was like, you know, that story can resonate with so many of us. And my dad was a dentist, and people would make fun of my teeth because they were like, "Oh, your dad is this." Clearly those sorts of situations. And if this happens to us, it's also happening with our patients. So I think, you know, when we think about our assessment, when we think about those questions, it's a good opportunity. But yes, that is an amazing video, isn't it?
I'm like composing myself because it's just so beautiful. I just love the ending too. And he's like, "She's now my boss." Anyways, I thought
Yes.
thank you for sharing that. That was really, really well done. Kerry, I was wondering, whenever whitening comes up, sometimes the questions come up about what is the active ingredient. Can you help us navigate the conversation between like the hydrogen peroxide and the carbamide peroxide, how they're different, and really what that means to us?
Yeah, for sure. And again, years ago, I knew this inside and out. And then I was like, okay, well, what's the difference? You see this, you see that. The ads are plastered across there about how this one is better than that one. And the truth of it is, I want to just touch on a bit of the history of carbamide peroxide. So I don't know many of us were aware, but carbamide peroxide actually was discovered in World War I, and it was used as an antiseptic agent to treat ulcerative, ANUG, acute ulcerative gingivitis. And then in 1962, it was introduced as a gel to treat inflammation in the periodontium after ortho. And one of the side effects was those teeth got white, and they realized that that might actually be a good agent to also think about in using it as a chairside option. And so when we think about whether it's hydrogen or carbamide, that molecule has to break down. So that peroxide has to break down into oxygen radicals, which migrate between the enamel prisms in our teeth. And what it's able to do is it's actually able to break down the color molecules that are in there that lead to discoloration intrinsically. So if you have think of it as a glass prism or like a reflective mirrors. If your mirrors are dirty, you don't get that nice sort of shine through. It doesn't show reflect the image as nicely. But when we use peroxide type materials, it opens and clears up those prisms so that way then they can reflect the light better. And that's how whitening works from an intrinsic perspective. But the whole thing is that we really want to make sure that we are aware of the differences between hydrogen and carbamide. And in that situation, I want to share this slide with you that really, I think, will break down this conversation even easier with what it is that we have to show. And let's just, there we go, sorry. Let's your screen too. So in this slide here, what we can easily see is we can see the differences between hydrogen peroxide and carbamide peroxide. So hydrogen peroxide usually is one of those molecules that doesn't stay, it doesn't stay together for as long. So it's a shorter wear time. It'll break down faster. The other thing is that these products usually have a shorter shelf life. It also, when you look at the percentages, they are generally 3 times stronger than carbamide peroxide. And this is where that sort of mathematical equation, some people think because it's 40, it's better. Well, maybe that 40 and maybe a 15 are okay. Maybe that isn't a good amount. Maybe those are sort of paired up as equal strength. The other thing is you really want to choose hydrogen peroxide or carbamide peroxide based on the color of your teeth. Just like you want to assess your patients with whether they have gingivitis, stage 1, 2, 3 perio, based on how they present, you should have different treatment options for that presentation. So if you have someone that's got the typical yellow and brown stains, hydrogen peroxide is a great option for that. And maybe that's something you're going to do chairside, like a chairside option with Opal Boost, or maybe that's going to be a pre-filled Opal Go tray that patients take home with hydrogen peroxide in it. But if you are looking at carbamide peroxide, which is what traditionally we've always used in our take-home trays, right? Those custom trays we've used, this really is one of those slower breakdowns, and 10% is the most studied carbamide peroxide whitening solution out there. That is literally what the gold standard of it is. And so if you have somebody that has sensitivity, 10% is the best opportunity to start with for that individual. The other thing is, as I said, it's equivalent to a third of the hydrogen peroxide. So my math was wrong. I said 40 and 15. We know 40 and 15 don't work, but we'll go with 45 and 15, okay? Clearly, we'll read the slide versus just like ad-libbing it as we go. It has a longer shelf life. And again, this has a wider variety of opportunity for color changes in individuals. It is best for those wear times, and you can choose based on your client's needs, your client's wants, your client's opportunities and wishes, whether that's going to be a long or a short term. And so what does that mathematical equation look like? And this is why I wanted to share this with you here. So if you have a 3% hydrogen peroxide, that's equivalent to a 10% carbamide peroxide. And so as you're comparing products, as you're comparing opportunities for your patient, just know that these are sort of all grouped together, and this is an easier way to help distinguish or to understand the differences in those peroxide type solutions. The other thing I want to make sure that we think and talk about as well is I want to look at what color are their teeth. And so when it comes down to this aspect, when it comes to the color, one of the things I really want to make sure that we look at as well is choosing the right whitening product for your patient's needs. So what are you looking for in a whitening product? Well, to me, there are 5 key things I want to make sure are in my whitening solution or whitening product that I can recommend with confidence. What are they? One is I want to make sure that it has water. Why do you think water is so important? Anyone on my panel want to guess?
Well, it's a living, breathing tissue, so it needs to be hydrated, right?
Exactly. Hydration is important for sensitivity as well as for rebound. How many times have we tried to whiten and patients get extreme sensitivity and they leave white and then 2 days later they start to bounce back? And that's that dehydration that happens. And so Opalescence, years ago, they were one of the first companies out there that put a lot of water and hydration in all of their products. And so that is a huge thing. So you're going to lighten and you're not going to have that rebound and reduction of sensitivity. The other key thing I really want us to focus on is we now look at the pH of all sorts of different products. But if somebody's going to be having a hydrogen peroxide or carbamide peroxide gel on their teeth for a period of time, and some of our patients wear these every day and they almost over whiten, okay? We want to make sure that it has a neutral pH. We do not want something with a problematic pH sitting on that enamel for long periods of time over time. Again, over time, products have changed, but some products still do not have a neutral pH. Make sure that you're recommending a product that does have that to reduce the risk. What about sensitivity options that are built into that whitening? We know that that's one of the biggest problems for patients with sensitivity. One of the biggest problems for whitening is sensitivity. So why not recommend a product that also has potassium nitrate in it or fluoride that's built into the system so patients can whiten and not suffer from sensitivity? It's an opportunity to make sure that you have the right lens and the right opportunities for your patients moving forward. I think that those are some really great key takeaways when it comes down to selecting your hydrogen peroxide or carbamide peroxide, and then identifying that as well with some key things you want to make sure that you look at when you're selecting your treatment gels.
Wow, Kerry, you've given us like a checklist so that if you're not using these products, you can go back to the office and go, okay, do I have these items? Are these ingredients in the products that you're carrying at your office? Gee, there's so many treatments available. Do you have a checklist or some tips or some type of tree that we can follow in trying to help our clients select the right product for them?
I do. And I think that that's the key thing. And just like we were talking before we got on about different kinds of scalers, and we were talking about some of the new innovative stuff and the differences, and we need different scalers for different treatment options. And I think what I used to think is, well, we have day weight, or we have opalescence PF, and that's what we have. But we need to have a variety of options in our treatment. But before we can figure out the treatment that might work for that patient's needs, we need to identify, what does that patient look like? What are their needs? So what is the age of that patient? That we can whiten now with teens and adults and seniors. As long as their permanent teeth are fully erupted, whitening can happen in those situations. So I think of my orthodontic patients. I worked in an ortho office here in Ontario for 2 years, and the amount of times I would deband those patients and they would say, can't I whiten? And I was like, wow, your teeth look great. We got the right occlusion. Oh my gosh, look at your before and after. And they sit there and go, but my teeth are ugly. I don't like the way they look. And I'm thinking, they were like this before, and now they're like this. They're perfect, and you don't like the way they look. And all they could see was the color of their teeth. And so I used to say to them all the time, no, you can't whiten with ortho. You have to wait. You have to do it after. But maybe that is an opportunity that we can bring into our conversation: whitening with aligners, whitening with brackets, whitening before, after, during. What about patient selection of those individuals that are coming in and they love to share with us some of their amazing things that are going on in their life? Maybe they're getting married. They've got a special event. There's a prom happening. We need to have different options to help them. Maybe their wedding is next week because they, we're finally fitting in their hygiene appointment. They want to make sure they're white. Well, maybe a chairside option is the best choice for that patient. Or maybe it's going to be something that they take home. We also need to think about those patients when we treatment plan the right need and find the right solution. We need to look at, do they have cosmetic work that's required? We want to look at, are they in aligners? Did we realize that we can actually put whitening solution in those aligner cases and help our patients through that journey as well? And there are certain individuals that want to have it done quickly. That's a very important need of theirs from discussing and identifying. So having options and choices that can work well in this space is really, really important. So when it comes down to selecting the products, you really want to look at that checklist, like I mentioned. We want to look at do they have opportunity in their product to help reduce sensitivity? What's the hydration? What's the pH like? And then what is that percentage? When it comes down to that percentage, I also want to make sure that one of the other things we look at, as Anne-Louise said, is I want to make sure that I'm also looking at the color of their teeth to help me identify what's going on. Because how many of us have done our assessments, right? We do our probing, we do everything else. How many of us are actually assessing the color of their teeth as well? And again, this wasn't something I did. And so this is a great opportunity for us to say, hey, we're measuring, we're looking at their blood pressure, we're looking at all these other conversations. Let's assess where your colors are. And based on the color of your teeth, guess what we're going to do? We're going to identify the product that might work best for your color or your shade. And so this is a great opportunity, a great chart that just sort of outlines, if you are a brown, maybe you're going to be better with a custom tray like an Opal PF. Maybe you'll respond well with a chairside option like a Boost, or you could use Go. But how many of our patients also have endo concerns and have that wonderful brown orangey color tooth? Did you realize that you could actually whiten those endo teeth as well? We might not be able to, but we can discuss it with the doctors and they can offer that service for the patients. And so there's a lot of different choices here. And so this is, I think, a great color wheel that kind of gives you that perspective. But in this space as well, there are opportunities to help patients that I didn't even know existed that have concerns with tetracycline. Maybe they don't need to pay for 20 crowns. Maybe they'll be happy with meeting halfway in the middle with improved color of their teeth and having it natural from utilizing whitening for a period of time. So there's a lot of different options here that we have that we can really do our best to help our patients identify what's going on. How can we improve that? Because this is really an exciting time for me and for us to be in dental hygiene and to be able to have different treatment options, and we can tailor it to their color, we can tailor it to their needs, and this is really the key thing. The other thing I want to talk about when we think about the options we have, one of the biggest questions patients always say to us, well, how long are they going to last, right? That's always a question. And the truth of it is that there's not a definitive answer. We have to look at a few factors. We've got to look at how we're going to help them reduce the loss of the brightness. And so that comes down to things like diet and dietary habits. Smoking can affect whitening results. We know different kinds of foods and drinks can affect whitening results. It doesn't mean that we can't have those patients whiten and we don't want to not offer that service. Maybe for that smoker, we're going to whiten for 3 months. Maybe that's what we need to do in order to get those long-term results. Because with browns and oranges, you're going to see changes in 5 to 7 days. But like I said, with tetracycline, that could be 2 months to a year long version in order to get them lighter. And when it comes to smoking, the same thing. Sometimes it takes 3 months longer because of that continual stain that they're continually adding. It doesn't mean that we shouldn't offer that service for that patient.
So this is all very interesting. So what you're saying is like we can really integrate whitening into our patient care plans. Like we should be offering whitening, because I'm thinking as you're speaking, like all the different types of clients or patients that we can help. But how would you, like, what do you think would be the next step for actually integrating whitening into the patient care plan?
And I think that we have to bring it to the forefront that we don't want to just put whitening as an aesthetic component. When we think of Dr. Fisher's daughter and how the color of her teeth were literally affecting her self-esteem, her self-awareness. And so what I really want us to think about when we think about this is we want to find opportunities to add that professionally supervised whitening solution into our care plans. So one of the best things we can do is ask the right questions. Is it on your health history? Are you asking your patients when you're doing your iTero scan, do you like the look of your teeth, the shape of your teeth, the color of your teeth?
Mm-hmm.
We're asking. Again, we measure our blood pressure, we measure all of their probing, we measure the bone loss. Why don't we measure the color of their teeth as we're going through?
Mm-hmm.
If we don't let people know we offer these services, then they don't know to come to us for that professional. Instead, they're going to turn to TikTok, they're going to go to the local drugstore, and there maybe are some good products there as well. But people want to know what our professional opinion is for them. And one of the easiest ways I think we can do better as a profession is incorporating this assessment into treatment planning or new patient exams. New patients are a great way to start anything new because they don't know that you didn't do it last week. They just know you as a new patient. So why not start with those people? The truth of it is, right? They don't know any different. You don't have to be like, you've never done this before. Why are you doing it now? It's like, okay, forget that. We'll get to that patient after. Let's start with our new patients. You know, this can be done by the assistants. It doesn't even have to be done by the doctors. It can be part of their full assessment and evaluation. And let me tell you, if you send them home with like a color shade guide that says, hey, you're a B1 or you're like a D, let me tell you that patient leaves and is like, ooh, I don't like that. How do I take that? How do I get it better? They're going to ask the opportunity and the option. The other thing is I've had many patients when it comes to treatment planning it is in the last little while that have wanted to have replacement partial dentures. And how many of those people were like, well, just get a new denture and make it match the other teeth. And they say, I don't like the look of the other teeth. They're so yellow. Do we have to? And I was like, okay, well, no, we don't have to. You're right. And so sometimes, again, we just in our mind don't think that it is an option or a thing that might be concerning or interesting in those patients. So we want to make sure that we have those opportunities to help them. The other thing is that we really want to kind of look at some questions. And guess what I have? I have some questions that you guys can ask patients here, not to worry, okay? So treatment planning is the key factor, and I think it has to be part of that whole conversation. So these are some smile evaluation questions that maybe may resonate. I'm not saying you have to ask 8. Think of 1 or 2 that you think might roll off your tongue easily that you can kind of bring in. Are you just happy with your smile? That's open-ended. Yeah. Well, tell me what you like about it. What don't you like about it? You know, are you happy with the way your crowns and fillings look? No, you want to change them? Well, now is the perfect time. If you want to change those, why don't we think about lightening your teeth so we can make those crowns as light as possible? You know, are you satisfied with the shape and shade of your teeth? That is a very easy question that rolls off our tongue and we can really identify their needs. Do your teeth hurt? I think that's an important question. Do you have sensitivity? Because if that's the case, we want to make sure, again, we choose the right products that will help reduce sensitivity while whitening. And maybe in those small circumstances, patients maybe need something prior to help reduce that. And then, you know, if you could change something about your smile, what would it be? That's a great question because they're going to come up with ideas and opportunities that maybe we didn't even know existed. So I encourage you to make sure that you're asking some of these great questions to help your patients know what you want to do and where you want to go. The other thing is come up with a protocol list. We need a checklist of where to start. And to me, the easiest step forward is new patients. Add it to your new patient questions. Literally, you have a Vita shade guide. You have all sorts of shade guides in your practice. I love these opalescence ones because it's like a tear pad. You can have them, you can give them to your patients. It's super simple. What about on a recall exam? You ask one of those smile evaluation questions and they say, yes, you know what? I want to have those class 5s. I'm ready to have those class 5s fixed. And it's like, before we do that, would you want to lighten your teeth so we can make sure that it's as light as possible? Because we know once those are in there, the doctors aren't going to want to change them after. But those would be conversations I would never have brought forward until the last little while. I know us hygienists in particular, I'm going to speak for the group of us, I'm going to group us all together. We love scans and we hate scans at the same time because they take time in our chair and we don't always see the value in it. I think that when you're doing your scan, let's educate them on all the things we see, but also ask them, what do you think about the color of your teeth? Is there something there or aesthetically that you would like to change? It's a very easy question that it doesn't look like we're selling, and we're just gathering the data and information to move forward. And again, talk to your treatment coordinators, talk to your front desk, and make sure that it's part of their questions before they go ahead and do all of those anterior crowns. Are they happy with the color of their teeth, their crowns, their bridges, their implants? If they're doing diastema closures, how many times have diastema closures been done and then they're like, oh, I wish I'd lightened my teeth beforehand. I don't like the color of them. It's like they look really great, but they're still that color. And it's like, gosh, if we had known, we would have done it the other way around. And so the other thing is, let's not leave our ortho patients out. So many adults are having ortho, so many kids are having ortho, and this is what they're turning towards, that there are opportunities and options that you can literally lighten and whiten throughout the ortho treatments going forward. So within that, when it comes to the aligners, again, Opal PF in the United States, I know we've got some people joining us from the US. In the US, if you use Invisalign, you have an opportunity to add whitening to those kits. They come together. So it is a paired. Why, when else it came north of the border for us in Canada, that wasn't really where we're at, I don't know. Things get stopped at the border sometimes, but this is a great option and an educational piece that, again, I can't believe like 2 years ago, I didn't know that that was an option, and the amount of people I said, no, you can't do it. And so again, with aligners, you can do it quick with like a 35%, like an hour wear time, or you can do it slow and go all night long. One of the biggest concerns with whitening and aligners is, can it whiten under an attachment? And remember, whitening is intrinsic, so it whitens around that attachment. So you're not going to have a big spot that it didn't lighten or whiten or brighten. So you can whiten with aligners, and they just use their trays. So some people like to put dots, some people like to put a line. Both work very effectively. You just want to make sure you don't overfill them, and they're set to go. Whitening with brackets, again, another opportunity. And one of the side effects of hydrogen peroxide does help a bit with tissue. We do not want this product on the tissues. That's not the goal. We do not want burning. But one of the things that hydrogen peroxide does, it helps to break down some of the plaque. So with our ortho patients, in an ideal situation, have them use them at least a week before they deband, and you could have them use a week after, or you could have them use 2 weeks before they deband. And then when they leave, their teeth are super nice, white, and easy to use. These pre-filled trays are a really great top seller for opalescence worldwide. Opalescence is a product that's available in all sorts of different countries, and this is one of their top sellers because they're pre-filled, super easy to use with hydrogen peroxide at 10 or 15%, and really great options. Chairside is another thing we need to think about when it comes to treatment planning. We need to make sure that we look at opportunities, and there are lots of chairside choices out there. When it comes to your chairside options, I want to make sure that you're getting your exceptional results. I've seen so many times, and I've experienced them in the past, where I lightened, they bounced back, and patients weren't happy with those results at the end. So make sure you're getting those exceptional results. And the interesting thing, I love the word boost, because the idea with this product is it boosts you forward, and then it continues to lighten for 48 hours after your patient leaves the chair. So they're going to continue to have that lightening going forward. The patient comfort, again, all opalescence products have the potassium nitrate, the fluoride in it, so it helps to reduce the sensitivity as well as the hydration as we're going through. Some products read your manufacturer instructions. Some of them have prep. You have to have them use ibuprofen. You have to have them use this toothpaste before they do it. Do patients always do that? We know they don't always follow the directions. So why not make it easy for you where there's really no preparation, except if that patient's maybe super sensitive, but there's always that exception to the rule, but on a whole, not to worry. Another topic that we could spend hours talking on is chemical activation versus light activation. Follow the manufacturer instructions for the product you're using, but not all products, particularly Boost, and there's other ones out there, for chairside, they do not require a light. Why do I like the non-light option? One, A, I don't have to buy a light. Two, the light itself can create some heat. And sometimes what happens is that viscous jelly material starts to run. And how many times have we unfortunately had burns on the tissues as things have run out? So one of the neat things about Boost is it comes in a color, so it's easy to see. And there are quite a few dam type materials that are in different colors. And this one is green, so it's very easy to see the difference. You don't have an issue. And the red gel makes it super easy to see. After any chairside option, even if they say they don't need them, I really think the best way to get the best results is to make sure that they do use either a custom tray after or continue with a whitening option. But when it comes down to that and choosing the right option, I also want you to think about the products that you offer and to make sure you have different solutions and choices to match them to their shades.
Amazing. I love that you are bringing into our minds, it's when we think of whitening, sometimes it's this option. And like you said, we don't always ask the questions, but it's something that meets those chief complaints. Like sometimes, and sometimes they're not offering us that information. So I just love how practical you've made this for us. When thinking about the patients and what they want, it can be very debilitating if they're not happy with their smile. Mm-hmm. So I love that you've made that, you just put it in such a practical way for us. So thank you for that. Can you also speak to sort of the business side of this? Because with whitening, it has a very unique place in our dental practices. So can you speak to sort of the strategy and even the business side of whitening?
I think that is an opportunity. Sometimes we feel bad because we make money off whitening or we want to provide that service. And some people choose to do it as a value add, and that's okay. But I really want you to think about this opportunity because people are spending millions of dollars on Amazon, at the grocery store, at all sorts of, non-certified, non-Canada, non-regulated sections, and they're putting them in their teeth, they're ingesting that stuff. This is our opportunity to make sure that they know and they're using professional grade opportunities to help that individual. The other thing is, I want you to think of it as if you have a menu, like if all four of us go out for dinner, we may all choose a very similar type of wine, but we may choose something different. And so having different options in that business side, I think is really, really important. So I like to make sure that we choose an approach for that business side to fit that patient's needs. So that means that we have to find something that fits their lifestyle and fits their budget. And so when it comes down to that aspect of the business of dental hygiene, I think it's important for us to kind of look at opportunities for us to figure out what works for that patient. And this is how we will create the business side from it. We need to have something that's a chair side option for patients, for those patients that do not want to come back, have difficulty, keeping appointments. Just get it all done in one day and be finished. When it comes to something to take home, maybe that's an opportunity for that patient in our business that maybe they require a second appointment to come back and get those trays. And what we do the first time that they're in, we scan them, we print their models, and we create and fabricate those trays for them. Or maybe the opportunity in that menu for that patient is just to give them the Opal Go option where they can just leave and the pre-filled trays are super simple to go. But why not get creative and offer opportunities and make it like a menu for patients? People love having decisions and having choices. So coming up with combined options and tailor those options and know that those flavors, those strategies of combining some of the whitening match their colors. It's like creating a treatment plan for your stage and grades. This is our opportunity to really figure out the best option to think about in a business sense. There are opportunities here that are left on the table that we are leaving to, non-certified products. And this is our opportunity to really bake it into our program to help our patients with their needs. When it comes to creating and combining these options, I just wanted to highlight 2 or 3 cases that are really interesting. So how many times have you had your patients go through ortho and they have a diastema closure that they require? This is an opportunity where this individual, 17 years old, they used Opal Go for this. Just get rid of this here, sorry. They used Opal Go, and what they did is they only used it for 2 weeks prior to debanding. And this after picture was taken 1 hour after they removed the brackets. And so this patient was able to, through the business of whitening, we were able to confirm and get this patient to say yes to going ahead with restorative procedures. And so this is one way to help your business and to move forward so then patients are more likely to say yes to treatment. This is an individual that unfortunately had the yellow discoloration and tetracycline stain. Look at the before and after situation. But this patient wasn't just a one and done situation. This patient used the Opal PF. They used the boost, and then they used Opal Go after. This was something that continually started. And one of the biggest concerns with this individual was sensitivity. So they started off with a 10% carbamide peroxide. Then when the patient did not experience any concerns, they moved it up to a 15% for 2 weeks. And the patient was able to manage that. And she said, well, things are improving. I want to do something more. So they did the boost. And then they followed up with the Go. And 6 months later, this is where she ended up. And so these are opportunities that we can really change people's lives and offer the right services for them. And then finally, this is a patient that required, wanted to have some of those fillings replaced, and she needed to have some of them done. And so she wanted to do whitening. And this is a 10% Opal PF in a custom tray that the patient wore for 15 nights. And in that situation, the patient went from a B3 to an A1. And so we have different options and opportunities when it comes to it. And I think sometimes combining these options and creating those treatment plans based on their colors and shades is really how we can create the right business strategies.
I hope you can share some of your slides with us so we can, because I can't take enough notes. And I just feel like, to know like the boost, the go, like it's all like new words, new products.
Yes.
For us. So it would be nice if you could give us something that we can share with everybody after. It's just really great, Kerry.
No problem. No problem at all.
Yes, this is a practice-changing presentation today that will allow us to really effectively address our patients' needs so much better. So thank you so much.
I'm glad.
So in the past, we've been worried about talking about whitening because so many people experience sensitivity. And I think you've outlined like ways that we can really combat that. So do you have any lasting tidbit thoughts on how we can prevent that?
I do. One of the key things, and early on as a baby hygienist, I learned a lot about potassium nitrate in a fluoride toothpaste. So if anyone back there took Rotodent or ProDentist or anything of those sort of products, we're talking years ago, we know we had the Fluoridex toothpaste, and that was like the best standard for reducing sensitivity because it had the fluoride plus the potassium nitrate. And with all the research I did for sensitivity, potassium nitrate kept coming up as a great option for reducing that with sensitivity. And so we know that potassium nitrate works really well at depolarizing the nerve and reduces the nerve transmission. And guess what? With all of my research, when I was trying to figure out what to do, I found this chart that was published in 2023 in the Dimensions of Dental Hygiene. What was amazing about it is it gave us lots of options. So depending on what you have available, here are some choices that you can do to help your patients with bleaching sensitivity. And a lot of the common themes are, of course, use that low concentration, which we talked about before, would be your best bet for patients that potentially have sensitivity, and to use bleaching products that contain potassium nitrate. This is something to, if they're concerned, use something with potassium nitrate 2 weeks prior. So maybe that is a Fluoridex type toothpaste option. Also, it talks about skipping trays. And I've had patients do that. I'm like, extend your whitening instead of it being 14 days. We're going to do it for 28 days and you're going to do it every other day can be a good option. And then in here, it also talks about using potassium nitrate trays for 10 to 30 minutes before bleaching. And so Ultradent actually has a desensitizing tray that patients can utilize. So if they're super sensitive, they could pop one of these in before or after whitening, and it will provide that potassium nitrate, fluoride, and hydration to the teeth to help reduce that. Some of you may know good old Lisa Moore. I actually gave her some of these, and she used them before she took off some attachments for a few patients that were extremely sensitive. And she said that they really significantly reduced it. It didn't take it all away, but it significantly reduced the patient's discomfort, and she is hooked on these. So they do work for a variety of different reasons, but this is one of those sort of opportunities out there. I want you to think about potassium nitrate as an opportunity to help those patients when it comes down to the whitening sensitivity.
Amazing. Kerry, thank you so much. This was just so insightful. And I just feel like you're the perfect person for whitening, right? Because you're so good at that assessment and looking for clues and asking the right questions. You get so curious about the patients who are in front of you. It's almost like it's almost your kind of special area, I think.
It is. Now, before we conclude, can I just share one more thing, actually, because I'm really excited. Well, again, that energy that Kat talked about, like, wait, I have to talk about one more thing. So I want you to think about this from a perspective, because sometimes we shy away from whitening because we're worried about the selling. And there are 3 key things I want you to think about. 1, you need to inform your patients about the opportunities. We need to make the right recommendations, and we want to promote procedures we offer to patients, and we don't want to sell it. So don't push it, make it a natural conversation, use some of those leading things, create those customized options that will fit them. And remember that patients look to us for their recommendations. They want to know what it is that we do. They trust us and respect our knowledge and advice. And we also want to make sure that we educate them, because they're going to rely on our insights as we go forward. And so I want you to remember 2 things before we conclude. And I don't know where my Zoom went, so now I'm having difficulty finding it, but I've got a really great slide I have to show you because I was so excited when I made it. Give me 1 second here as I try to find my image. Where did Zoom go? Anyways, it was a picture of a sock, okay? And it was like, you might bleach these dirty socks, but why don't you bleach these beautiful teeth? And I think that that's where we're at now, is we really need to kind of look at options and opportunities to help our patients move forward. So that's what I wanted to add, Beth. Thank you.
Of course. I think I was like you and I kind of go back and forth as like the hook, like pulling each other off the stage. That was my pulling you off.
Can I add one thing?
Of course you can.
I'm just thinking, because a lot of times we'll take a course, we'll hear something, we get excited, and we don't know what's the next step. So for me, what I like to do is, collect your information, have a meeting with your team, focus on this one thing for 3 months, right?
Yeah.
Make it a habit in your practice, because otherwise it's not going to happen. Track it. I've got a tracking day planner I'll send you, a day sheet organizer, like design your day. So look at your day sheet, who's coming in, and pick two patients a day. Once you start that, you get comfortable with the selection, you get comfortable with the verbiage, and then you track at the end of the day, like each dental hygienist, I did two, and then it just flows, right?
Yes.
And we can't feel bad about selling, because we're not selling. And any successful dental practice, it has to be a dental business. So we can't be uncomfortable with, we're not trying to sell something that we don't believe in. We know it's going to help them for all the reasons that you said.
Yes.
So it's like, just get that out of your mind and know that you're doing a good thing, and make it a focus for 3 months. And then it becomes a natural part of your practice, and it'll just be going like crazy. Because Kerry, I was the same as you. Years ago, it was like very heavy into the whitening, and then it just stopped all of a sudden, right? So I love that you brought this up. I love that you've got me charged, and I'm going to share this with other people. And I think this is awesome. So I will send everybody like the follow-up email, the after email. So probably by Wednesday, you'll get the recording, you'll get the certificate, the questions, and I'll throw a few other little things in there. And Kerry, anything you can share, some of your slides, some of your checklists, would be awesome.
And I have a QR code, but for some reason I can hear you, you guys can see me, but I can't see Zoom anymore. So this is welcome to technology. This is, just carrying op number 3 today. So I actually have a QR code that I created. My CRD is willing to give away 3 Opal Go samples to people that are exclusive to watching this show. So Kath, I'll make sure that QR code is in the email. So all of you, please check it. Please enter to win, and you have an opportunity to try it in your practice. And if you ever want information on the Opal Go line in Canada, we are happy to do like a lunch and learn, a mini session, and educate you all on it. That's really what it's about, is education and finding the right fit. So please do think about including this stuff in your practice. It's going to make such a change to your patients' outcomes.
One more question. What's a good age for whitening? Like, when do you think it's good for us to?
So I would say for sure anyone, most people past 14 would probably be where I would at. But if they have all of their permanent teeth, they're all erupted and they're younger and they're competent to do it, it really does depend on that patient. I have one child that I would have done Invisalign with, and one that I would never have trusted him with Invisalign. So it really does depend on that individual, but usually 14, 15 is an okay time to start if you're comfortable with that.
Okay. I'm taking some of these notes here from everybody. Okay.
I think by that age, they're a little bit more responsible, and that's why I feel like that's a good starting point for them.
Okay.
Sorry, Beth.
No, all good things. No, this was awesome, Kerry. Thanks so much. There's a lot of comments just coming in. This is really insightful. And I think that there may be some questions that we didn't get to, so they can reach out to, what's the best way to reach out to you, Kerry, if anybody has a follow-up question?
So you can reach out to me through Instagram at Kerry Lepicek. If you can put that in the chat, because I can't even use the chat, that'd be great, Beth.
Sure.
Or my email, Lepicek at clinicalresearchdental.com. That would be wonderful as well. And if you have questions, you can always call Clinical Research about whitening. They're happy to do that. They're happy to talk to you and answer anything you have there as well.
And I'll add your email, Kerry, to the follow-up, the after email as well.
Perfect. Yeah, sounds great.
Put your Instagram and your email in that.
Wonderful. Thank you.
Perfect. That's awesome. Before everybody heads off, Kat's going to close us off and just let you know about all the exciting things that are coming up at RDHU. Just another huge thank you to Kerry. And I just want to say one thing about our beloved Kerry. I think one of the really hard parts about hygiene is the on, right? If you've had a bad day or if you're sad, you kind of have someone in front of you who just wants something from you. So we are always on. We become very programmed to being on. And Kerry, you showed up today and you did a fantastic job. And you received some bad news last week about your eyes. Kerry gave me permission to share this with you. So Kerry was diagnosed with glaucoma in her left eye. And for anybody, that would be very devastating information to receive, especially in the profession that we're in. And you showed up and you're here. And those of us who know you and love you know how good you are with assessment and asking the right questions. And Kerry, you pushed to be seen in spite of the doctors kind of brushing you off initially. You pushed and you got yourself in there. And I want us all to just come around you and show you so much love and just admiration. So Kerry, we love you. We love you so much.
Thank you. And yes, it was a very interesting few weeks I've had, but I think it's important for us all to advocate, and that's why I literally had to advocate for myself, despite that I knew it probably was bad news. But the good news is I have a good eye, so life is good. We'll focus on that, but please make sure you advocate for your patients. Do all the assessment you can. Look at their blood pressure. Get your eyes tested if you don't know, because I don't have any risk factors, and I'm one of those weird normalities of it. So, but thank you all for the community, everyone, for your support. And sometimes we need an extra little hug. So I feel that coming from all of you guys, and thank you.
So whoever's going to be at ODA, Kerry will be there, and she's taking all the hugs that we can possibly give. So look out, there'll be a huggable line for you at ODA. So
thank you.
Yes.
Thank you.
We're going to swarm you.
Yeah, exactly.
Okay, I'm going to share my screen. If you can just a quick what's coming up, because there's a lot of really great things coming up. And I just want to start with the hands-on programs. We have our ortho courses that we do with Lisa Moore. When Kerry was talking about Lisa Moore is our ortho educator. We have a perio program in person on the Saturday in June, and then I'm doing masteries for instrument longevity, selection and optimization on the Sunday. The bacteria party with Kerry and Beth, which is going to be an awesome day, and that's sponsored by BioGaia. So this is all happening at RDHU in Burlington, Ontario. For those of you who want to fly into the Toronto area, we'd love to have you. And then Anna Louise, your masterclass. This is like a fabulous, I don't know if you want to take 30 seconds just to share what the masterclass, the hygiene masterclass.
Well, thank you. This masterclass is about precision instrumentation and techniques. It's really for the seasoned veteran or someone who wants to really be involved in complex cases and doing the most you can with some advanced instruments. And I will be sharing techniques, and you will get to practice some techniques with a wide variety of specialty instruments. We'll talk about how to tackle some of those interesting morphology situations. So yeah, come and join us for the day. And it's a limited class and hands-on at RDHU.
Perfect. And I just shared the live streaming so you can see so many things. Like we have so many wonderful programs that are live streaming, and you always have access to them for 30 days after. We are PACE recognized for our American friends and for those who require that, and on demand through Dental Hygiene Quarterly, and then our in-person, our myofunctional therapy program, so many things. And yeah, so thank you so much. For those of you who are new with us today, thank you and welcome to RDHU. You'll be part of our community. So if you want to stay with us, you can stay with us. If you want to unsubscribe, you can unsubscribe, but we hope you stay. We have dental hygienists from all over the world, mostly Canada. Next would be the US, and then we have some globally as well. So great community. And this is our Give Back, the show, the RDH View. And so thank you so much. And Kerry, you did a fabulous job.
Thank you.
Yes, and you shine bright, and thank you to all of you who joined us today.
Thank you, everyone. Have a wonderful time, and hopefully I'll see some familiar faces at ODA.
Yes. All right. Goodbye. Have a great
Bye.
weekend.
Bye.
Bye.